work to get COVID-19 vaccine into the community quickly and widely. We anticipate more and more vaccine reaching Arizona heading into April, which is making it possible for us now to expand prioritization. We have been flexible and nimble throughout while expanding the availability of state sites to vaccinate large numbers of people rapidly. As we look toward getting more and more vaccine, and as the demand for appointments among currently prioritized groups continues to decrease, this is an ideal time to make vaccine available at all of our state-operated sites. As of Monday morning, there were still 58,000 appointments available from Friday's release. Arizona has done a great job at using all of the vaccine available to us, and this change helps us keep that momentum. The change also applies to federal pharmacies, or federal programs for pharmacies and federally qualified health centers. Counties can still sub-prioritize within each of the groups, so you'll want to check where your county stands. However, most counties, or some counties, have moved to prioritizing their general population. As of this morning, doses administered in Arizona was approaching 3 million, and individuals with at least one dose was approaching 2 million. Meanwhile, more than 1.1 million Arizonans have been fully vaccinated. At least 3 states are already vaccinating all adults, and several others are set to make the change. And as you know, President Biden has said vaccination will be available to all by May 1st. The state and our county partners are committed to distributing vaccine equitably. In fact, a recent CDC report rated Arizona as one of the best in the nation for getting COVID-19 vaccine into vulnerable communities. AZDHS is expanding our targeted outreach among underserved areas. That will include our disability community. So we will be working with our partners to get vaccination out to those communities. We will also be launching public service announcements and promoting vaccination to our underserved populations and to the general public. And with that, I'm happy to take any questions. Hi, Cameron.
So can you explain the factors that went into this decision, specifically on demand and supply? What are you expecting at the end of this month that will make such a significant difference on the amounts of supply that you're getting by the end of the month compared to what we're getting now? And you could talk a little bit about those numbers and then talk about demand too, because it's a balancing act, right? So if you could expand on that a little bit.
Yeah, absolutely. So we want to keep the forward momentum going with our vaccinations. We were actually a little surprised that we still had that many appointments left, and that was at every state site across the state. And so in order to make sure that we're utilizing our resources efficiently, what we wanted to do was open it up to everyone who was eligible. When we were going to open it by age categories, what we identified was that we were already meeting a large portion of those with chronic medical conditions that put them at higher risk. But because of the age category, we weren't able to vaccinate those that lived with them or worked around them. This way, what it'll give us the ability to do is the ability to vaccinate entire families at the same time and really use our vaccination and the pods, because what we were noticing was people were able to find earlier appointments and canceling out here, and almost 3,000 a day. So we really want to be able to utilize this efficiency. We do expect to get increased amounts of vaccine starting at the last week of March, beginning of April. So we're excited to see what that allocation will look like for this week, but it's supposed to significantly ramp up through the month of April.
What do we get now? Last check, I think it was around 300,000 total doses across the 3 major vaccines. What will that hopefully go to with that next ramp up?
So what we're hearing is that they're going to increase it by several million each week over the next few weeks. So we get about 2% of that. So we're hoping that what that would give us is about 40 to 60,000 additional doses a week.
Every single week. And when it comes to demand, how are you weighing what you know when it comes to data? Are you using data to confirm demand decreases? We already knew that there would be a significant portion of people who not going to get the vaccine. They've chosen to not get it. They feel that that's their right not to get it. How much was that also play into this decision?
So when we looked at the age groups, what we anticipated was about a 55 to 60% uptake in each of those age groups. We anticipated actually having more 55-year-olds that were interested in getting vaccinated, so that's why we were surprised that we had such leftover appointments this week. So if anybody's looking, you can go to podsvaccine at AZDHS.gov or call our call center to get those appointments.
Obviously, some folks are going to be a little worried about the competition out there. What do you have to say to them? How will you make sure that, like you said, those vulnerable populations, those who might be disabled, those who might speak a different language, who don't have as much access, how will you ensure that they don't get left behind when we have a huge swath of people who might be interested? And what's the size of the population left in this group? I'm curious, of the 16 plus, what's that population look like?
So we anticipate that there's about 1.8 million Arizonans that are under the age of 18. So out of the 7.3, that's about 5.5 million total. We've vaccinated almost 2 million with at least one dose. So that leaves us with about 3.5 million. If you anticipate that only about 55% are going to want to take the vaccine, we're probably looking at 1.5 to 2 million. That's just rough back of the napkin math. What we will do for those specialized groups, like our individuals with developmental or intellectual disabilities, we'll be working directly with our partners at DES and with some of our advocacy groups in the community to schedule vaccination events specifically for them, or potentially reaching out through their health plans to get them vaccinated. For some of those special communities, we're working with healthcare providers that are trusted sources in those communities through our county health departments to make sure that they're offering community-based vaccination sites in their area. So we know that transportation's a barrier, we know that language is a barrier, and so we'll be taking the vaccine directly to them. I think a lot of the people who have already wanted to get vaccinated have gotten vaccinated, because they still could qualify as healthcare workers, as teachers, those types of things. And so I would imagine that some of it has to do with vaccine hesitancy, although some of it may just be we've already vaccinated those individuals. So those are all great questions. We anticipate it'll still probably be the summer or the fall before we reach herd immunity. We know that there were certain phases where people, you had phase one, which is there's so much demand and very little vaccine. Hopefully we're starting to get out of that phase and into phase two, which is the demand meets the supply. And then phase three is when the supply outpaces the demand, and then that's when we're going to be doing, you'll see our messaging change. So today we will be releasing, it's today, right, Steve, our PSAs? So you'll see starting today that we've got PSAs running, really reaching people to let them know the vaccine is safe, it's effective, when it's your turn, get it, because we want people to start thinking about that, but it'll probably still be a while. So that's one of the things that it's so important to get it to where, to community locations where people don't need to travel by car out to one of the mass vaccination sites. This is obviously very efficient, but it doesn't help those that can't get out here. So we'll be working with that. As you continue to see the supply increase, you'll find it at more pharmacies. You'll find more doses available at pharmacies. You'll also start to see them at healthcare providers, so your primary care and those types of things. Trying to get it out to where people who may not be as motivated to come out to a vaccination site, but if they were at their doctor or they were at Walgreens and they were like, oh, we have vaccine available, they'd go, oh, well, yeah, I've got time, I can go do that right now. So really then trying to make it convenient.
What does this mean to you? Being able to open this up to 16 and older? I mean, it's been a hectic year.
I think that this is a very exciting day for us to be able to open it up to the general public because, you know, I think that some of those decisions on how to prioritize and who to prioritize were just heartbreaking. I mean, no one wants to have to activate a committee called the Vaccine and Antiviral Prioritization Advisory Committee. It was one of the first times we had to do that. And so I think that this is now, whoever wants it is now eligible. They can find it in pharmacies, in FQHCs, and, you know, and more places as we continue through the summer.
Stephanie, we're going to go this way.
Yeah, you mentioned cancellations or no-shows. So how many people are getting vaccinated a day here, and how many are no-shows?
So we have the ability to vaccinate about 12 to 15,000 people here. We've been doing between 8 and 10,000 vaccinations. What we've been doing is, as we identify cancellations, we've been opening them up to our call center so that the call center has appointments every day that they can fill into. But we've been getting quite a number of cancellations. As many as 3,000 is what my team has told me, yeah.
Do you think that's just because sometimes people will, like, book at a pharmacy that can get them in earlier? Or?
And I think that that's one of the things that going to this new weekly date release will help. You know, when we were scheduling appointments for 2 to 4 weeks in advance, people were able to identify like a pharmacy nearby that had it, and then they would either cancel or no-show. Now, one of the things that they do try to do at these sites is, because we know we've got a certain amount of no-shows or cancellations, they would do the plus ones and make it eligible. Well, now everybody, you know, as long as we have the vaccine and the appointments, everyone in the car would be eligible for a plus one as well.
And you mentioned the PSAs. I mean, are you concerned that we might not reach herd immunity, given especially 58,000 appointments? And maybe there's more hesitancy than, you know?
So I think that that's always been a concern of ours, whether or not we would reach herd immunity. You know, we anticipate that we'd need around 70%. That would be our goal. And so, you know, based on our surveys that we did prior to the FDA reviewing the data, we knew that 55 to 60% at that time were willing to take it. So we've known that our work is cut out for us to get all of the people vaccinated that we need.
And then just two more questions. One is, was this a decision of VPAC, or was it you and the governor, or who made this?
Yeah, so when we met with VAPAC the last time, they had approved us moving down in the ages unless demand indicated that we should move more rapidly. So we had said about the 55%. When we looked at the appointments, this was a decision that my team made the recommendation to the governor's team that, you know, with 58,000 appointments still available, and knowing that we've got a lot of individuals that come with family members and that this was a good time to just open it up.
So was it VPAC?
Not to move directly to 16, but to open it up as we saw based on demand.
And then the last thing is, when can people, I had a few readers who try to reserve already, and they're in some of the younger age groups, and they said they were having trouble with 16 and 17-year-olds. When can
Right.
people actually start, you know, in those age groups, start reserving?
Yeah, so they should be able to start reserving Wednesday morning at 8 a.m. Just to let everybody know, Pfizer is the only vaccine that's approved down to age 16. So at any state-operated site, those that are 16 and above can get vaccinated. The Moderna and the Johnson & Johnson or Janssen vaccine is approved for 18 and above. So just make sure that if you've got a 16 or 17-year-old, that they are that they're coming to a site that's doing Pfizer. You're welcome. Hi, Dylan.
So, at what point, I know you said that it's like still around 55% of people still want to get vaccinated. I know your goal for set higher for that was closer to 70%. So first, like, how do you reach that goal at this point? What are you seeing for how you get to those percentages of how many more people get vaccinated?
Yeah, so we were seeing pretty high vaccination rates at the beginning with our healthcare workers and our 75 and above. We knew that as we got down farther in the ages that it would be harder to convince people to get vaccinated. And so we're going to continue to provide education, to survey the community. but also meet people where they are, so that you know, if it's due to language barriers or transportation barriers or technology barriers, that we're in their community. But we're also going to be working with community leaders, and that's some of the things that you'll see in upcoming PSAs, is working with those leaders to encourage people, to have them encourage people to get vaccinated.
What's going to be done about these like underserved community areas? Like I know there was 85009 was the first time that you guys had like taxis help them reach. What's being done for those communities of people who aren't being able to get the vaccine as fast as possible in their areas?
So we're expanding that pilot into the South and Central Phoenix area. So we'll be doing those same type of activities, the targeted high-intensity communication. But instead of like bringing them out to a mass vaccination site, we're working with healthcare providers in the county health department to get vaccination clinics right in their community. So very similar to what we did with testing, where we had community providers that were trusted provide kind of those wraparound services. But in addition to testing, now we'll take some of those same sites and add vaccination to it as well.
At what point do you think you'd be comfortable telling the governor that it's time to end the state of emergency? Like how many people need to get vaccinated? What do COVID positivity numbers need to look like? What are you thinking?
So our COVID positivity, percent positivity is trending down. It's looking really, really good. We continue to see declining case rates. With the vaccination, I don't know that we'd have a number. We'd want to see continued demand. So it's hard to tell. It's kind of, there's not really a set formula to when we would say that about the emergency, because there's other things that the emergency allows us to do, like to continue working with DEMA and to draw down funding. So it would depend on where we were and how those things that would be affected by it would be affected. So,
And last question.
yeah.
Can you just talk a little bit about what these PSAs are going to be, where they're going to be targeted, and just whatever information
Yeah.
is going to be in this?
So what we'll be doing is we've got Spanish PSAs and English PSAs, and so we'll be targeting them through social media, really trying to get the general population. It will go out to the general population for just general awareness and information, but then we will also be social media targeting like some of the Spanish PSAs to some of those underserved areas so that they can see it from one of their trusted leaders.
So we've seen when new age groups get opened up that the website gets flooded and there are some technical problems. So potentially millions of more people are going to be able to sign up Wednesday morning. How prepared is the website this time around, or is it going to be the same type of messaging all day? Keep trying, keep trying, keep trying.
So we continue to make enhancements to our website. This time, as people go through, they won't be, their appointments will be saved, so they shouldn't be able to have them snatched out from under them, which will be a big, huge help, and we've heard a lot of comments on that. What we anticipate, we won't be releasing a large number of appointments. It'll be what's ever available from this most recent release. But then on Friday, we'll release more. So what we would encourage people, we continue to have a team that kind of stands on to make sure that we've got the adequate number of servers and that it's processing okay. But we would say probably for the next 2 weeks, anticipate high demand, and then it will likely slow down after that.
So is that try every day or try every Friday?
So here's what I would recommend. Definitely try every Friday, because that's when the majority of the appointments are going to get released. If you are free and you're looking for something to do and you need to get vaccinated on a same day, you can call our call center. I would recommend calling like right at 8, because we release new appointments to the call center every single day.
One of the incentives for people to volunteer at this site was that they would get a vaccine also. Are you worried that this would plummet volunteer numbers, and would that affect this site because it wouldn't have demand?
So what we would do is, if it did impact our volunteer numbers, but I think we've had such a good, our volunteers have had such a good experience out at the sites that hopefully they would continue to return. We have waiting lists of people that want to be volunteers and businesses that have reached out. But if we had to, we would just work with ASU Assure to get contracts to pay people to be out here. So it shouldn't affect the operations of the site. We would just transition from volunteers to staff.
And finally, I
Yeah, so we have to think in 3-week blocks at a time because we are always scheduling that second appointment for anybody who's getting their first dose appointment. So currently we are scheduling appointments right now for the overnight clinic here at State Farm. But that is something that we would take into account. You know, ultimately we want this to be where people receive their normal health care. So as we get more and more vaccine and as it's at more federally qualified health centers and doctors' offices and Walgreens, there will be less of a need for these types of things. So what we've been doing is just taking it week by week to determine, okay, if the demand slows down, then when should we phase this out? And as it gets, right now we've got about 500 pharmacies that have been activated through the federal pharmacy program, but we have up to 800, so we know that not all of the pharmacies have vaccine yet, and even when they do, it's like 100 or 200 doses for that week. So we would probably anticipate having something like this until there were adequate supplies.
I know it's. Do you think this site will be operational throughout the whole summer during those overnight hours?
So what we're looking to do is to not keep State Farm Stadium activated through the summer. We're looking at a venue to potentially move it indoors. And so that I think the Cardinals need their space back. I asked them for 6 to 8 weeks. That was back in January. And now we're here through potentially May. So we are looking for that indoor site. It's going to get awfully warm here, and our iPads aren't going to work out in the heat quite as well. So we anticipate having that at least through May, maybe into June.
Hi, Dr. Christ. This is Daniela with Vaccination. So with the expansion of the eligibility, State Farm is 24 hours for the moment. I know summer is heating. Are you anticipating to actually increase the hours? Are you anticipating to increase the hours with the other vaccination sites that are operated by the state? Because, I mean, when COVID is decreased, it's going to be incredible amount of people. Are you fear that it's going to happen like happened in other states, that they roll out was accelerated and then kind of crash and they couldn't keep up with all those people that were eligible?
So we are looking, all of our sites are scalable. So they all have the ability to scale up to almost what State Farm does, if not meet what State Farm does. So we are evaluating, and we can always add hours before or after, but we still also have capacity to add appointments to each hour. So right now, State Farm's running about 500 appointments an hour. And we will be operating this throughout the night at that same pace. But if we had to, we could add more, or we can add more hours to other sites. But we anticipate that we'll see a lot of demand over the next couple of weeks, and then it'll probably slow down.
So in this next allotment of or expansion of appointments and doses, does that depend at all on AstraZeneca, which would be the fourth brand that would be approved, if it's going to be approved?
So no, that does not rely on the AstraZeneca for our projections. That would just increase the supply even more.
So basically, we would hope for that, of course, but everything is just on the pre-vaccines for now. Do you have any rough numbers as to what's coming in this week, if it's changed since what you told us last week?
So the numbers I gave you should be what's being shipped today. They've told us to anticipate that would be our baseline, and I think it was like 160,000 of Pfizer, 130 of Moderna, and about 15 or 16,000 of Johnson & Johnson. So we anticipate that outside of the Johnson & Johnson. For the Pfizer and Moderna, that's our baseline now moving forward, but they continue to promise to potentially increase. But then they're also increasing allocations to the federal programs, which come directly out of the federal allocation.
Thank you.
You're welcome.
Dr. Chris, I guess the decision to open it up to 16 and over for vaccination, is this coming much sooner than you had anticipated, and is that a good thing?
Yes, so it is coming sooner than we anticipated. We anticipated initially looking at May 1st, but we think that this is a good thing because it's going to take a lot of the questions out of whether or not you're eligible. Everyone now is eligible, and we will work to get as many people vaccinated as possible.
And I guess, what do you anticipate this week? I mean, that's just a big age group to open it up to. Do you anticipate just a big demand and a lot of people filling up those 50,000 plus appointments? What do you expect?
So we would expect that this week and probably next week, the appointments will go very, very quickly. So we've had, 100,000, 110,000 appointments go within 30 to 45 minutes. That's why I think we were so surprised to still see this morning we had almost 60,000 appointments left. So we anticipate that those will probably Wednesday morning go pretty quickly. And then again on Friday, those 80,000 or so that we open up will also go very quickly. But if as long as people are patient, they will be able to get a vaccine.
And then lastly, I know you touched on it a little bit. There are a couple of other states that have opened up to 60 and older. We're now doing it. Again, kind of sum up the message to the community. How big a deal is this?
So this is a really big deal. It means we're reaching into a new phase. So everyone's eligible. We're not prioritizing based on any specific ages or any type of occupation. This is, as long as we continue to get the vaccine, I think that this is really, we're earlier than we anticipated, and I think that's a very good sign because we're just that much closer to the light at the end of the tunnel.
We have time for one more question from
Yeah.
Hi, I wanted to ask, so this announcement only applies to the state-run vaccination sites. So what about Arizonans 55 and under in other counties like Mojave that are, it's farther for them to get here to Maricopa County sites? Why not open up the appointments to them as well?
So the state sites are open up to everybody, and so that will, anybody who wants to get an appointment.
Their counties,
Yeah, so the other thing, we are the ones, or the state AZDHS, works with the CDC and their programs. So all of the pharmacies and federally qualified health centers that are participating in the CDC pharmacy partnership programs will also move to that, and that would be statewide. So where they may sub-prioritize is if it's a county-based program, and they still feel that they've got a lot of demand, so they want to prioritize it to that older at-risk population. All right.
Thank you, Dr. Christ.
Thank you, everybody.